The coronavirus disease 2019 pandemic has caused catastrophic disease worldwide, although children have been relatively spared. Severe lung involvement with acute respiratory failure is the most common complication of COVID-19 in adults, but many have complications in multiple organs, including the heart. Adults with severe COVID-19 typically present during the second week of illness, a time coinciding with declining viral loads and increasing markers of inflammation. These observations suggest that host tissue damage is mediated by dysregulated innate and adaptive immune responses. In contrast, most children and adolescents with severe acute respiratory syndrome coronavirus 2 infection have mild COVID-19 that does not lead to medical intervention. In late April 2020, clinicians in the United Kingdom reported a cluster of 8 previously healthy children presenting with cardiovascular shock, fever, and hyperinflammation. On May 14, 2020, the Centers for Disease Control and Prevention (CDC) issued a national health advisory to report on cases meeting the criteria for multi-system inflammatory syndrome in children. In published case series, many of the pediatric patients with this hyperinflammatory syndrome have had fever and mucocutaneous manifestations similar to those of Kawasaki's disease, a rare vasculitis of childhood that can cause coronary artery aneurysms. Some patients have presented with features of toxic shock syndrome, secondary hemophagocytic lymphohistiocytosis, or macrophage activation syndrome. Although the cause of Kawasaki's disease remains unknown, a preceding or active infection has been suspected. Like Kawasaki's disease, MS-C is a syndrome with a range of clinical presentations and an absence of pathognomonic findings or diagnostic tests. Unlike Kawasaki's disease, however, MS-C has been suggested in early reports to predominantly affect adolescents and children older than 5 years of age and to be associated with more frequent cardiovascular involvement. Characterizing the epidemiology, spectrum of illness, clinical course, treatments, and prognosis of MS-C is key for reducing morbidity and mortality. In April 2020, the CDC initiated surveillance for severe COVID-19 in children and adolescents. The coronavirus